Hey everyone, and welcome to podcast 83 and sponsored by DTE Energy. And I'm Meghann Keit, Korean, part of the MAC Government Affairs team. I still have to get used to my new last name as of last year, COVID bride. And your podcast host today. I have Deena Bosworth, the MAC Director of Government Affairs, and also our guest that we are very excited to have, the Department of Health and Human Services Director, Elizabeth Hertel. So welcome, Director. Thanks for being with us.
Hey, Meghann. Hi, Deena. Hi, everyone. Thanks for having me.
Well, we are so excited and congrats on your new appointment to the state's largest agency that we have here. But before you were promoted to the director role, you've been at the department for some time, had various legislative roles, and worked in the healthcare industry. So why don't you just give us a little bit of background and a little bit about who you are?
Sure, thanks. I started in government in 2005, working in the office of then State Representative Bruce Caswell, who was chair of the, at the time, DCH Appropriations Subcommittee. And so I had the opportunity to learn quite a bit about the community health side of what the current department is today for a number of years. After I left Representative Caswell's office, I went to central staff for the House Republican Policy, where my paths crossed for the first time with Deena. And we did. And I worked on health policy, community health appropriations, and a number of other policy items, retirement, health insurance, senior services. I had a pretty broad portfolio of items that intersect usually at some point. I left for about a year in 2010. I did some consulting with public sector consultants. I went to Blue Cross Blue Shield to work in their policy office for a few months. And at the end of 2010, the opportunity arose to go back to the House Republican Policy Office. And so I returned, continuing to work on health and human services policy. In 2013, I went over to work at the Department of Community Health with then Director Jim Haveman. My first major project was working through the development and passage of the legislation for the Healthy Michigan Plan, which is Michigan's Medicaid expansion. And that's been extremely successful, more successful than any of us actually ever dreamed it would be. Currently covering just over 800,000 individuals in the state under the Healthy Michigan Plan. Normally it's around 650,000, but with the COVID effects on the economy this year, we saw that safety net work with the Healthy Michigan Plan, and people were able to maintain that coverage. In 2016, I had an opportunity to go work for a health system with Trinity Health, which is the St. Joseph Mercy St. Mary's system across the state, and really get a great understanding of how the policy developed at the state level is implemented on the ground level. And that was a great opportunity for me to really get to know the state, work with some other stakeholders in a different capacity. And when Governor Whitmer was elected, I was asked to come back by the former director in the role of the Chief Deputy for Administration, so acting as a Chief Operating Officer essentially for the department. And I've been in that role until just recently when I was appointed as director last month. So it's been fantastic.
Oh, well, and not an easy job, right? Especially in the COVID response that we're still under right now. Can you talk a little bit? Obviously, we do want to talk a little bit about the COVID response, some of the new federal guidance rolling out, further vaccination plans. But in general, can you just talk a little bit about the department priorities, what your goals are in your new role, and then maybe we can dive into some more details on COVID response time.
Sure. Obviously, at the top of everyone's priority list is making our way to the end of the COVID pandemic. And I think this year, the last couple months have been especially optimistic, more so than the time in 2020, because we see the vaccines coming out, we see people being vaccinated, and we know that is really the key to ensuring that we can return to some sort of normalcy that we knew prior to 2020, before COVID came in and ruled our lives. So I work a lot on the vaccination rollout, the strategy and implementation of that right now. And outside of that, focusing on a lot right now with the employees in our department. I know, every state employee, probably every local government employee has worked tremendously hard over the last year. And that's no different for our state employees, both on the public health side, but also on our human services side, in our legal, our financial operations. And so making sure that, we take this year and the next couple years to help people realize the importance of the work that they do, the pride that they should take in the work that they're doing, and the difference that they're making in so many people's lives. It's really easy, I think, for us to get bogged down in the day-to-day of trying to make it through this very strange time, not just professionally at work, but also personally at home. Many people have children who are being virtual schooled. Many people are trying to work from home, which is very different. Many people, probably know somebody who has contracted COVID. Unfortunately, maybe has lost someone they love. So everybody is navigating this world differently, and that includes our state employees. So making sure that we continue to build them up and honor the work that they do is going to be really important. One of the things that happened this year with the COVID-19 pandemic is it really shone a light on the significant disparities that we see among different populations in how things like COVID-19 can affect them, especially among our more vulnerable populations, people who are older in nursing homes, African Americans who may have chronic conditions already were adversely affected, as we saw in Detroit being one of the first cities that was really struck hard by the COVID-19 pandemic. And so we will refocus and put additional focus on equity and diversity when it comes to developing and implementing policies at the state level, and looking at all of our policies, both employee and state policies, through a real equity lens to make sure that we are trying to create an environment where equity is a priority. And beyond that, in the coming year, continuing to think about the social determinants of health and how we can build up our infrastructure there, knowing that people's health outcomes are a result of more than just going to the doctor's office, and how we can continue to focus on that. Working on our children's services, both in our licensing and our residential facilities, our JJ, but also a focus on behavioral health services for kids in the state is going to remain a priority. And then a little less exciting, but very, very important, continued focus on our information technology funding, the way that we're using that funding and the way that we monitor it moving forward will remain a high priority as we work through the rest of the year.
This is no small job. Holy cow.
It's not. It's not a small job, but it's a great team. It's a great department with 14,000 employees who chose to go into the field of health and human services, who are really dedicated and really passionate. And so, when I start listing things, you're right. So, wow, that sounds like a lot. But when you think about all the people that we have that are here and ready to make things happen, it's very exciting. I think we have some great opportunities ahead.
I love that you are just so passionate about the people who are there and working and doing their best every day, because as long as they feel good about what they do, they're going to be able to help so many more people. So that's an awesome focus.
Well, thanks. Well, they're pretty awesome people, super smart, way smarter than me.
Well, and we also with representing county commissions across the state share a passion and interest for a number of those topics that you mentioned, from obviously our staff in the local health departments, and we always advocate for supporting them and the jobs even before the COVID hit, and they had to focus a lot of their attention there. They were a big player and part of the health in our communities before this. So we were, and juvenile justice and child welfare and all of these things that we definitely share in your priorities, that we definitely look at working with you in the department. We had a couple of questions from our members that were a little more specific that I thought I'd put out there. One was related to COVID and of course reopening. I know that everyone wants to get out again. Everyone wants to go to a restaurant. I wanted to have a wedding. I want August to have 300 people in our outdoor space. So what do you think about a coordinated effort, working with the legislature? Obviously they've been they pushed back a little bit on some of the things the governor and now the DHHS director has implemented. But what do you see as far as working with the legislature, continuing to reopen, and what that looks like maybe for our state?
I think it's important to remember, even when we get caught up in some of these discussions that are occurring, that everybody has ultimately the same goal. We want to get through this pandemic, and we know how to get through the pandemic. We know how to mitigate risk. We know how to keep our case rates down. People wearing masks, continuing to socially distance, limiting their large gatherings. And people have done that because we're seeing our case numbers go down, and that's really exciting. So people do know and understand and have taken an active role in helping to make that difference. And as we bring the vaccine online, that will only continue to improve. So I think, when we're working with the legislature and between the administration, and I have, a unique perspective having had the opportunity to work in both places, that sometimes we just need to keep talking, and we just need to make sure that we're explaining what we're doing and they understand and they're asking questions, and that we are able to provide a message that is uniform and that that people understand, so that we can continue to move forward. I don't think people don't think the things that we're asking for are important. I think they absolutely do know that they're important. And so we will continue to move forward in implementing, the increased testing, our vaccination strategy to, help us get to the end of this pandemic.
Well, that's good. I think I agree with you. That just keep talking and having those lines of communication open, it does help significantly. You started talking about, again, the vaccine, and that's your priority, your major focus. So another question that had come in was, is there a 3-week planning process? Meghann knows much more about this than I do, so I'm going to ask the question, but you guys are going to know a little bit more what that is. So as far as coordination between the federal government, the state government, and the locals, can you talk a little bit about that interaction and some of the rollout challenges?
Mm-hmm. Okay. The main barrier that I think all of us are seeing here at the state level and at the local level is the actual quantity of the vaccines that we have available. We're seeing incredible demand from people to be getting vaccinated, which is really exciting. And so since, January, even into December, we were more focused on a smaller group of priority individuals. But when we're able to open that priority group up to people who are 65 and older, some essential workers, teachers, childcare workers, that we knew we would not have enough quantity to meet the demand. However, we've been working very closely with FEMA and the Biden administration to get to a point where we know how much we're going to be having coming into the state, And we don't know from week to week, although the past few weeks it's been fairly steady, what the allocation will be coming into the state, and getting to the point where we can help plan 2 or 3 weeks out as far as quantity for local health departments and other providers. We're really excited. Right now we have the Pfizer and the Moderna vaccines have both been approved by the FDA for use. Those are the 2 that are being used. Those are both 2-dose vaccines. Next week, the FDA, I think, will deliberate on the application from Johnson & Johnson, which is a 1-shot vaccine. And there are the potential for maybe another 1-shot vaccine to come into the United States as well. And having those different options available and the different manufacturers available will certainly help bring that quantity up and give us more opportunity to reach the specific populations that we're looking for, that we know are more vulnerable to transmission and severe symptoms, as well as the general public, who also obviously are very interested in getting vaccinated.
Yeah, and I want to touch a little bit, I know we're coming down to a few minutes here left, but I want to touch on those most vulnerable populations. And we've had a couple commissioners reach out, and they've been very excited about the mobile clinics that they have rolling out. And a member had just asked if you have any guidance or best practices and how to most effectively run these mobile clinics, because I think getting to those vulnerable populations, rural areas, it's going to be a really great new phase and next step, I think.
I'm just silent because I don't know if you can hear Jack in the other room. You might be able to. Sorry. Okay. Anyway, the opportunity that we have with the mobile clinics is it's great. And what the thing that I would recommend the most locally is continuing to focus on the community partnerships, the local stakeholder groups, through churches and other community organizations, to help reach those specific populations through extended partnerships. I think that's going to be one of the most effective tools that we have, is making sure that everybody is communicating with one voice, and that we are getting assistance in finding the populations and understanding how to best reach them, whether that's through a church, whether that's in a casino, in the emergency department. I mean, we have so many different places that we could look to be able to bring vaccines to where people are.
Okay, so we'll get to the casino and get vaccinated.
There you go.
I'm sure my people will love to hear that. I also
by the way, don't worry about Jack either, because this happens all the time. It's either my dogs or Megan's dogs or Steve's kids, and they're, you'll see them in the background all the time. So,
yeah, he was just over here off camera, so he didn't quite make it in.
That's okay. He could have. We would have said hi.
Sometimes he does.
So with that, I really appreciate the time today. I think we want to make sure we're respectful of your time. I know you're very, very busy. But any last, thoughts or comments or anything we can do to help you in your new role, and anything really.
Thanks. I really appreciate the invitation to this. I think many times we assume that DHHS stakeholders are, hospitals and doctors, and while they are, and that's really important, our partners at the local level are vital for us, because we do have a decentralized public health departments, we have our CMHs, we have a lot of those actions that occur locally through a partnership with the state. And so continued conversation, please, I'll come and speak or answer questions at any time. I think that's the best way that we can move forward, because we want to make sure that everyone has the resources that they need, and that we're getting the feedback and the input from people who are implementing the policies being developed at the state level on the ground.
We appreciate that. Thank you so much for joining us, and thank you everyone for listening to our podcast today.
It was good to see you.
Thank you. Good to see you. Bye.
Take care. Bye-bye.
Bye.